The following top 5 worst lifestyle choices contribute to 3 out of 4 cases of kidney disease globally. In this video, we'll not just show you the consequences of the 5 worst kidney damaging lifestyle choices. We'll focus on great ways to change the bad habits, to improve your health and to feel great in the whole process. Hello everyone, this is Catherine from Double O Kidney. This is the top 5 worst lifestyle choices for your kidney health. Number 5. High salt consumption. The problem with sodium consumption is that any processed food you can buy contains an unhealthy amount of it. And we're so used to it that even a small reduction in the quantity ingested can cause cravings. But high sodium consumption is really unhealthy for the kidneys and can do huge damage to several organs. It will put the kidneys under great stress, decreasing kidney function. This will cause water retention and high blood pressure, one of the main risk factors for kidney disease. Doctors recommend no more than 5 grams of salt a day, less than a teaspoon. So, how can you reduce sodium consumption to healthier levels? What the dietitians suggest is to train your taste buds. Gradually, reducing the salt amount over time will make you shift your sense of taste and start enjoying lower sodium foods. Avoiding processed foods is a fundamental step in this process. Number 4. Regular use of over-the-counter painkillers. Excessive use of NSAIDs has become more common than ever. Some people are used to take aspirin, ibuprofen or naproxen at the slightest symptom of headache or fever. But, as several studies confirm, excessive dosage of the drugs will have a harmful effect on kidney tissue and can reduce the blood flow to the kidney. NSAIDs can cause high blood pressure and can trigger an acute renal failure or chronic kidney disease, chronic interstitial nephritis. This is why patients with kidney disease, high blood pressure, or heart failure are not allowed to take NSAIDs. Even for healthy people, it's always recommended to take analgesics at the lowest dose and for the shortest time possible. What can you do to reduce the consumption of over-the-counter painkillers? Several non-drug treatments can be recommended. Yoga and massage have been proven to reduce back pain, headaches, and osteoarthritis pain. Staying physically active is always recommended for treating various kinds of chronic pain. Meditation, relaxation therapy, and deep breathing have also been proven to work in most of the cases. Number 3. Lack of exercise. The number of studies proving the importance of exercising for overall health is always increasing. But how much damage can lack of exercise do to the kidneys? Regular exercising can improve a number of metabolic factors like insulin resistance and blood pressure, thus preserving kidney and cardiocirculatory health. A large study published in 2013 in the Journal of the American Society of Nephrology showed that women who exercised had 31% lower risk of developing kidney stones. Lack of exercise, especially if combined with bad dietary habits, is the main cause of weight gain. Doctors say that 30 minutes of light physical activity 4 days a week can make all the difference. But what can you do to get the motivation needed to start exercising regularly? One of the best ways to do it is monitoring progresses, daily routines, and writing down everything. If this is not enough, try group fitness. Training with other people will give you a boost to your motivation. You can eventually get addicted to post-exercise endorphin rush. That is what really keeps people hooked to exercising regularly. Number 2. Junk foods. For some people, junk food cravings are just too strong to resist. Bad dietary habits are one of the greatest risk factors for a long list of diseases, including, of course, kidney disease. A recent study published in the journal Experimental Physiology showed that eating junk foods regularly can cause blood sugar levels similar to those found in type 2 diabetes patients. Just like type 2 diabetes, a risk factor for kidney disease, including in junk food eating can cause an accumulation of glucose in the blood, with severe long-term consequences for the kidneys, even diabetic kidney disease. So, what can you do to stop these dangerous cravings? One of the best advices is to drink a large glass of water before every meal and when you feel like wanting some junk food. In fact, thirst is often confused by our body with hunger and food cravings. Another helpful tip is to never go to the supermarket hungry. It's easier to eat healthy if you don't have junk food around. And if you go to the supermarket when you are already full, it will be a lot easier not to buy unhealthy foods. Also, always try to eat an adequate quantity of essential nutrients. Eat plenty of high-quality proteins, low-sugar carbs, and fibers to reduce cravings. Number 1. Not enough water. Keeping hydrated enough has a crucial impact on overall health. When you're dehydrated, kidneys have to work a lot harder to eliminate the toxins from the body. This can cause the toxins to accumulate, causing an amount of health problems, and can increase the risk of developing an UTI. Urinary tract infections usually start in the lower tract, the urethra, the bladder, but can spread to the upper urinary tract, which includes the kidneys, with a chance of causing a permanent damage. Lack of water is also the main cause of kidney stones. So, what can you do to drink more water during the day? My favorite tip is to always bring with you a bottle of water and to try to empty it during the day. It has been proven that drinking in small amounts at regular intervals is the best way to keep the kidneys healthy. Conclusion: the human body is designed to work as a whole. This means that the healthy lifestyle I am suggesting in this video will not only positively affect your kidneys, but your whole body and health. These lifestyle changes can be hard to start, but on the long run are what really rewards. A better health will give you more energy, more quality of life and happiness. This is all. If you like this video, subscribe now. Thank you for watching.